Welcome to Mental Health Nursing, Theories and Therapies. We're going to talk about the different theories that are relevant to working in mental health. First of all, we're going to talk about psychoanalytic theories. Some of you might recognize the gentleman in the chair next to the couch. It's Sigmund Freud. He's famous for talk therapy. He would have the patient lay on the couch and he would sit off to the side, not even looking at them, and he would ask them questions about their childhood and their early beginnings and any issues that came up, and they would talk about them. And this would go on for hours and hours, and then weeks, and then months, and even years. Used to be like 5 to 6 years that they would have these talk sessions. And they don't quite use that anymore. But Freud's was very influential in that he had a lot of parts of his theories that are still used today. And one of them is levels of awareness. He determined that there are 3 levels of awareness: what we're conscious of, what is preconscious, which means it's below the surface, just below the surface, and it can be accessed with therapy, or the unconscious, which is totally something, an area that we are not even aware of. If you look at the diagram here, you'll notice that the id and the superego are mostly totally in the unconscious, predominantly, which means we're not aware of them. The id is the part of us that says, I want and I'm going to get it, or I want and I'm going to take it regardless of the consequences, kind of like a toddler. The superego is our moral aspect and says, you really shouldn't do that. That's not right. Shouldn't take something from somebody else. And your ego does the reasoning and says, hey, wait a minute, let's maybe compromise. Maybe we want that, but maybe we don't want to take it from somebody. Let's work something out for all of us. So that's pretty much one of the things that Freud is known for. He's also known for defense mechanisms and anxiety, that we operate on this unconscious level to make us feel safe. So we don't even know when we're using defense mechanisms. We just know that we're feeling this anxiety and we need to feel safe. So our brain uses these defense mechanisms to deny and distort reality, make us feel less threatening. This isn't necessarily a bad thing. Sometimes it's a good thing. And we'll be talking about defense mechanisms in a lot more detail in one of the next lectures. So classic psychoanalysis, that's what Freud is known for, and it's really faded in use, but some of the other valid concepts that we use are that we do look at the experiences during the early stages of life to help us decide what are some things that actually determine this person's personality, especially traumas. And we look at their conscious and unconscious influences, and we look at the importance of individual talk sessions. They still have talk sessions in therapy, but it's more focused on short-term, brief therapy sessions. And attentive listening is still extremely important, but not to the extent as before. Freud is also responsible for transfers and countertransfers, and those are 2 things that we use when we relate to other people, say how the patient relates to the nurse or the nurse relates to the patient. We're going to be talking about those later as well, but that is something that came from Freud. Now, psychodynamic therapy is the newer model of psychoanalytic, and it has many of the same tools we talked about. The best candidates for using this type of therapy are people who have a certain area that they're having difficulty with. They're also intelligent and they want to change. They're motivated. They might say, I feel so uncomfortable. Please help me change. What do I have to do to feel better? So this type of therapy is more about them understanding themselves and how this type of therapy can help them. So it's more of this rapid back and forth talking between the therapist and the client. Let's look at a case study. Ms. V is admitted to your unit after being picked up by the police for intoxication and anxiety. After she's stabilized, she spends the rest of the night on suicide watch. In the morning, she's admitted for a stay of 3 to 5 days for evaluation. And that's pretty normal. If somebody has actually done something to hurt themselves or had a suicide plan, they usually stay 5 to 7 days, but 3 to 5 days is pretty normal for this. So the police tell her they're not going to press charges for disturbing the peace because she promised to get help. And she wants help. So interpersonal theory is something that would be extremely important in her therapy. And it's the foundation for Hildegard Peplau's theory, who is a nurse, an important nurse in mental health nursing. So this type of therapy is used best somebody who's experienced any loss or grief, or interpersonal theory means interpersonal disputes and role transitions. In this type of situation, the nurse is known as the participant observer. She both participates in the therapy and she's an observer. So there's an aspect of mutuality between the nurse and the client. And 3 things that are extremely important in this type of therapy is the nurse must show respect for the client and actually respect the client. They must unconditionally accept them. They shouldn't judge them for getting drunk, for example, to deal with their stress. And they must show empathy. Empathy rather than sympathy. Being able to put yourself in their shoes without feeling sympathy. So let's look at Mrs. V again. She tells you that she began drinking heavily over the last couple of weeks, that it's not something she's been doing for a long time. And this started when her boyfriend tried to break up with her. So during her stay, she starts receiving some medication for depression and having sessions of interpersonal therapy. Sometimes when you have an extremely difficult time of your life, for example, a breakup, a role transition, an interpersonal dispute, medications can help work on the harder aspects of that, things that you might not want to look at without some help of the antidepressants and having some extra serotonin. So behavior therapies are also very important in mental health. And I know you've all had psychology in your prerequisites, so I just want to touch on some of these that are behavior that are used. Pavlov's classical conditioning, if you remember, he was the one who did the experiments with the dogs that could make them salivate just on hearing a bell rather than showing them the food. And Watson's behavioral theory is way back when they were still using humans for experiments. And what Watson did was show that he could instill fear in a baby by showing them a white rat. So how he did this was, and that's the middle picture, he would bring a white rat out and he'd let the baby play with it, and the baby would smile and cuddle the white rat, and he would like it and he would be very happy. But then he would bring out the white rat, let the baby start to play with it, and then make a loud noise behind the baby that startled him. And he did this repeatedly so that eventually the doctor would bring out the white rat and the baby would show fear and start to cry and try and get away from it. So then we also have Skinner. He's responsible for operant conditioning theory. He's the one who taught the rat to push the lever to get the food and to avoid the button that would cause a shock. So these have implications for nursing in that we use them when we try to manage behavior, or we want to change behavior, replace a negative behavior with a positive one. We use the basics of these theories. For example, modeling is one behavior. We do this by modeling the appropriate behavior. So therapists use this, nurses use this, even on the mental health unit. How the nurse responds and talks to the patients is a form of modeling appropriate behavior in any hospital situation. Operant conditioning, that's what we talked about with Pavlov and Skinner. They use positive rewards for positive behavior, and we still do this. We might do this with toddlers. Systematic desensitization. So that's something that's planned and progressive. For example, if somebody has a fear of an elevator, can slowly get them back on an elevator and ride it by doing baby steps. First looking at pictures of elevators, then looking at real elevators, then having them stand in an elevator. And it's progressive. And they get desensitized by losing the anxiety they feel by looking at a picture of an elevator first, then losing the anxiety they feel by standing next to one, and so on. Now, aversion therapy is the use of unpleasant stimuli for maladaptive behavior. An example of that would be someone who bites their nails, and you put some bad smelling, tasting solution on their nails, and when they go to bite it, it stops them from biting their nails. And this works pretty well for a lot of people. And then we have biofeedback, and this is used a lot for anxiety especially, to help the person see on a chart where their anxiety is and where their blood pressure and pulse is, and to help them decrease these by watching and be cognizant of what they're doing. Cognitive theory is extremely important in mental health. It's about what goes on between individuals and the environment, about the interplay. So just to know that we have a thought, which comes before the feeling, which comes before the action. So we have a thought about something that's going to happen, a test maybe, and then we have a feeling. All of a sudden we feel anxiety when we think about this upcoming exam or test. And then our actions, is it going to be positive or is it going to be negative? Are we going to say, oh, I need to go study and go start studying? Or is it going to be, oh my gosh, I need to do something to avoid studying right now and avoid my stress. I'm going to go and do something else because I can't study right now. So what behavior do the thoughts and the emotions elicit? Cognitive therapy was developed by Ellis and Beck. The rational emotive therapy is Ellis. So what it aims to do is change an irrational behavior. For example, somebody could make a bad decision and say, you know what, I got this test, I got this anxiety, I'm going to go drink a lot of caffeine so I can stay up and study for a long time, which is not going to help the anxiety at all. And it's irrational. Unless there's no anxiety and people just maybe need an extra boost. But some people make an irrational decision based on their belief. So their aim is to recognize thoughts that aren't accurate. Yes, staying up all night before a test, drinking a lot of caffeine gives me more study time, but does it really help me do better when I'm exhausted for the exam the next day? Also, cognitive behavioral therapy is very important. So that's what we talked about. Thoughts come before feelings and beliefs. So what this therapy does is have the person look at their beliefs and help them to recognize that it's distorted and then change the way they think so they reduce the symptoms. For example, I'm going to fail this test, which is a distorted belief. And then get them to say, well, I could pass this test. I just need to study more. And that helps them feel more positive and helps them be able to study for the test. Humanistic theory, very important as well. If you look at the diagram below, the pyramid below, it's an example of Maslow's hierarchy of needs. Human beings aren't really motivated all the time, but in general, they're motivated. However, if the person is barely meeting their physiological needs, they can't strive for a self-actualization. So they are active participants in life. They're striving for self-actualization, and they're motivated. But if you look at the lower level again, physiological, when they're met, they can go on to the next level. If somebody's homeless and they don't even have the physiological part of, say, shelter and food met, how can they go on each one of these other building blocks all the way up to have good self-esteem, and to the very top, self-fulfillment. So the lower ones have to be met first. Now, Erikson is probably the most important developmental theory that we're going to look at. There's several different developmental theories. We're going to focus on Erikson. And he has 8 stages of development, as you can see here. So the personality continues to develop. They build on each other, these stages. But some people can get stuck in a stage. For example, somebody who is in the trust versus mistrust category, like before the age of 1, and they have poor bonding, or they don't have a caregiver who's very loving and who's not always there when they cry and doesn't always respond when they cry, they're going to not develop a good sense of trust. That's going to affect them for the rest of their life, unless they can work on it in therapy at some points in their lives. So this is also important because it's going to help you determine in your concept maps, which you are all going to be assigned to do, what interventions you're going to use based on what stage they're on and what they're capable of doing. So this is an extremely important part of nursing assessment, as I've said, and it helps determine what types of interventions are most likely going to be effective based on where they are. Milieu therapy. Milieu therapy is the use of total environment. And this involves the people, the setting, the structure, and the emotional climate. Now, this is important in a mental health facility, but in any hospital environment as well. The milieu is all of these combined. So in a mental health facility, the nurse is in charge of the milieu, making sure that there's support and guidance and assistance for people, making sure they're modeling the appropriate behavior. The nurse, especially the charge nurse, is the one who's looking at the whole milieu. What's going on in the hallway? What's going on at the desk? What's going on in the med room? What's going on in the day room? And making sure that it is a safe place for all involved. As a student, you are a part of the milieu as well. You are one of the people that's in the setting. And it's your job and your responsibility to be a positive part of the milieu. And this is the end of this lecture. Thank you.